Fabulous. Okay, so we'll just go on. That was really interesting. So now we are on to our last of our sessions here, which is a needs assessment for introductory radiation oncology curriculum for advanced practice providers. A national needs assessment. That's going to be Kate Martin who will be presenting.
Hi, everyone, and thank you for sticking it out all the way to the end to listen to this presentation. I'm very grateful for the opportunity to present on behalf of the team, including the advanced practice providers at MD Anderson, represented by Sarah Todd, Megan Gomez at MSK, as well as the physician group here at Brigham and Women's. So just to get started, just having a little difficulty advancing the slide.
It may just be a slight lag or slight delay for the first advancement. Something.
Just click on the Zoom window and then it should go forward.
Yeah, you have to click kind of twice. Yeah.
Oh, there we go. Okay. So just to go over the objectives, first, we're just going to take a look at understanding advanced practice provider training prior to getting hired in radiation oncology and their role in the radiation oncology department. We'll really briefly explore the online introductory training programs that are in existence, as well as reviewing the results of our needs assessment survey, and then discuss the future work going forward to get radiation oncology advanced practice providers up and ready to go and practice. So just a brief introduction. According to the most recent estimates, there's approximately 400 advanced practice providers currently working in radiation oncology in the United States. Prior reports have shown that advanced practice providers in radiation oncology spend about 80% of their time in clinical work, both direct and indirect patient care. They report running independent follow-up clinics, doing telehealth visits. They're members on inpatient consult services. They run survivorship clinics. Less frequently do they perform consults as shared visits with attending providers or OTVs. They do a lot of acute and late symptom management, as well as a lot of patient education. So they really kind of spend their time across a vast array of patient-facing care. So let's just take a quick look at the education background of advanced practice providers in radiation. So nurse practitioners and physician assistants both complete master's levels programs. Nurse practitioners follow a nursing model, whereas physician assistants follow a medical model in schooling. Both have a clinical and didactic component. Both end in a national certification exam and a clinical master's degree, and both have the opportunity to move on to an advanced doctorate degree, which focuses more on leadership opportunities and healthcare leadership in their doctorate programs. In the didactic session of their training, both APP groups typically do not receive introductory education in radiation biology, radiation physics, or radiation therapy. They're unlikely to graduate with any exposure to radiation oncology during their didactic lectures, simply because it's not tested on their national certifying exams. Similarly, during clinical training, APPs will rotate and possibly have electives in oncology if they desire, but the electives typically include hem-onc and solid tumor oncology, and it would be rare, even in an oncology rotation, for them to spend time in a radiation oncology department. In the postgraduate setting, most of the training is on-the-job training, and it really varies in content and quality based on the kind of team that's training them. So you'll see a lot of variety in terms of understanding basics of radiation oncology just based on the team that trains them. And that's not to slight the teams. You know, we all run really busy practices, and we tend to focus on what's most important in caring for the patient, and really getting down to those really basic core fundamentals of radiation oncology might not be what's most important for getting an APP up and running to practice clinically. There are some oncology postgraduate training programs. They can be called fellowships or residencies that APPs can go through. Mayo Clinic, MD Anderson both have oncology training programs, and the Dana-Farber is creating one. Again, you know, typically heavily focused on medical oncology with a little bit of surgical oncology and maybe some radiation oncology. So it really varies depending on the program. So going over what we did for our needs assessment survey, first, we looked at the ROECSG sites within the United States, and we basically cold called them either over the phone or through email to determine if any APPs worked within their department. If they did have APPs working in their department, we asked permission to kind of get in contact with them. And once we were in contact with the APPs, we obtained their permission to include them on a registry to be contacted for further networking and research opportunities. We developed a needs assessment survey with three main domains, one being demographics, the second being perceived preparedness for employment, and then the third being their preferred curricular content. And then we sent that survey via REDCap to the 145 APPs that agreed to participate in the registry. And using that REDCap program, we were able to distribute the survey. And just of note, the great work that the ROECSG team has done in the past with the IROC program, with the permission of the team, we did use their survey as a baseline and then modified it to make it more appropriate for the APP group. So with the results, first looking at the demographics, so predominantly of the 145 APPs, we did get 83 respondents, which correlates to about 57.2% respondents. Most of them had more than 5 years experience working as an APP. However, about 70% reported less than 5 years experience working in radiation oncology. So that what that tells me is that we have a lot of really experienced APPs who maybe didn't have exposure to radiation oncology in their early career, found out about it through working in other oncology subspecialties, and then joined us a little bit later on in their career. While next looking at preparedness, while most APPs did have a dedicated training curriculum, only 18% said that that training curriculum was actually formalized with lectures, workshops, one-on-one didactic time with their team. Almost 60% of the respondents said that they actually were unclear about what their goals and expectations for their learning was during their training period. And then despite completing their training period, almost 45% said that they did not feel confident in their radiation oncology specific knowledge or clinical skills after completing their training period. Looking ahead, 100% of the respondents did say that an APP training curriculum online would be useful for them. And 88% agreed that any opportunities to participate in resident education was helpful for their medical knowledge and clinical skills. So just a little shout out there, if you have an opportunity that's appropriate to include an APP in any education in your department, they will jump at that and gladly participate. So what we understood from this data was that APP training is typically on the job. It varies from department to department depending on the training team. We're really lacking in those kind of building blocks of radiation oncology. I know in my department, in my role as chief PA, I train all of the PAs that we hire, and most of them actually don't even understand when they come in the doors how radiation kills cancer cells. So they didn't get that education during their didactic or clinical training. We really have to start at the basics. And they did feel that an online program would be beneficial to learn those skills during their early training. And this highlighted the need for an APP curricular development course that focuses on the foundational knowledge of radiation oncology. So our future works is developing this course, and we've already gotten started on doing that. This is a screenshot of one of the slides where we go over the 4 R's of radiation biology, and we're really excited to move forward, share this with the 145 PAs. As part of our future work, we are going to run this course with a pre-test, a post-test, as well as getting feedback from the APPs about any changes or additions that they would like to make. And I'm really hopeful that I'll be able to come back next year and present the results of launching this course to you so that we can kind of further progress in training are the kind of newest working group to radiation oncology. And I hope if you have any questions, you feel free to reach out to me in terms of the curriculum or about adding APPs to your group. Thank you so much. I appreciate all of you staying around, listening, and feel free to ask any questions.
Fabulous. That was really interesting. And we have about 5 minutes still left for this entire session. So we actually have a couple minutes for questions if anybody wants to put anything in the chat here.
Actually, I did a question too, but Paris, go
Yeah,
ahead.
no, you go ahead, Anna, first. We're a
Okay.
good team. We can go back and forth because we
Great,
can
great.
fill 5 minutes, no problem.
Sounds good. So yeah, great presentation, Kate. So yeah, really great work. I think this is so important. It's something that comes up often in my work here, and we work with a lot of APPs, and so I think like kind of including APPs in our didactics. We've been trying to do that more, just so that we really do work as a team, and if we're all kind of on the same page with our knowledge level, or at least kind of like the important things to tell the patient, then it's really helpful. I guess you had identified something of like, one of the basic things of like even how radiation works, right? And patients will often ask about that. But I guess in your perspective and kind of doing your work in this area, what would you identify as like, one or the most important gap or gaps in knowledge to address first?
Sure. So we actually did, for the sake of time, I didn't include it in the slides, but we did ask the APPs what they felt would be most important in terms of curricular content to include. A lot of them felt that the basics of radiation therapy, disease site specific training, and foundations of radiation biology were going to be the most important. And in terms of the least important that they felt, probably just because of their experience as APPs in other departments, predominantly oncology departments, was kind of palliative care, delivering bad news. I think a lot of them felt really comfortable about that. In my experience, in terms of training the group that I have, it really is that kind of core. First of all, what is a LINAC? How does it make radiation? How does that radiation kill a cell? The really basic biology of radiation is really important to get them understanding, why we're doing what we're doing, and then going over the kind of acronyms for all the treatments and what the different treatments mean. So one of the slides in the course that we created goes through from kind of 2D APPA fields all the way through to the more advanced, protons or SRS, SRT. And so a lot of the PAs that I encounter have never seen these acronyms before. They don't know the difference between SRS, SRT, IMRT, 3D, conformal, 2D, and then also kind of GTV, PTV. So a lot of those basic acronyms that we take for granted, because we've worked in the field for a while, when they come in, they don't have any background of that. Their schooling didn't teach them that. And so we really do have to kind of start at the very basics and say, hey, listen, this is how radiation works. This is how we create it. This is why we target this area. And it may sound like it's, kind of redundant building blocks, but we just don't have the opportunities to get that during our training.